Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back, Guam. If you're just joining us, you picked a great time to watch our program because we are talking about hand dermatitis or hand eczema, a condition that leaves your hands very dry and very flaky, and as Dr. Jitka Lom from Express Care said, very, very painful. And she is here right now to take your viewer questions that you submitted on Facebook. Let's get right to it. Doc, you ready? Mm-hmm. All right, our first question comes from Dedido. This comes from Steve, and Steve asks Dr. Jitka Lom, can my diet trigger hand dermatitis?
You know, it can actually. There's a couple of ways that can happen. Some people are actually allergic to foods that they touch. A common example would be mango, the skin of the mango, not the inside of the mango. So they're peeling mango and they're touching the skin and they're getting irritation from that. Some people are also allergic to potatoes, and they peel them, they get allergic, they get sensitive and they get itchy and dry. Another way this can happen is if you're allergic to nickel. And the way you know this is if you cannot wear jewelry that is like, fake metal jewelry, like costume jewelry, you get itchy when you wear that. That's usually a nickel allergy. And certain foods contain a lot of nickel. That would be nuts, broccoli, peas, chocolate. That's the ones I can think of right now. Oh, and canned foods, like foods that are in cans. They tend to give you an aggravation of your nickel allergy. So you may break out after eating those certain foods. If you notice that you eat a certain food and then you break out, obviously stop eating that food.
Yeah, that's a really good tip right there. I know some people with peanut allergies, yeah. not a good thing. All right, our next question comes from Jason from Tumon. Jason asks, does overusing hand sanitizer contribute to my hand dermatitis?
It sure does. Hand sanitizer has a lot of alcohol, which is a very drying agent, and also many other chemicals, sometimes fragrances and so on, are in the hand sanitizers. And people use them liberally. They use it maybe 10 times a day. And so all that chemical on your hands can definitely dry them out, cause irritation and eczema and itchiness. So maybe stop that and go to the restroom, use your warm water and mild soap, and then moisturize.
And you've said this before, it's, hand sanitizers are best used. You don't necessarily have to rub it all over. You can just kind of like pat it together and just
a little bit, use it, but it's only to be used if you can't make it to a restroom or if there isn't one there, just as a stopgap, not as instead of water.
Okay, there are some moisturizing ones too. I noticed that on the market. Is that any better, any worse?
I don't think it helps.
Okay.
I don't think so.
Straight from the doctor's mouth. Good tip again. Okay, we go down to Jotna for question number 3. This comes from Lily, Dr. Lom, and Lily asks, is it true water can be an irritant?
It can for some people. Usually if you put your hands in water and they begin stinging or itching, it's something that's in the water. For example, the most common things that I see all the time are detergents like Joy, Dawn, and some other dish detergents that are very strong. So I always tell people to use hypoallergenic dish detergents and wear gloves. And sometimes other chemicals, if they're dipping their hands in, other detergents, using spray, using Clorox, those things can really irritate. But sometimes just pure water, it's just pure water and you put your hands in, your hands start stinging and itching. That can be a condition where you've actually gotten a yeast infection within the cracks and fissures in your skin. Then that can be treated again with medication. So water by itself, no, but water either with chemicals or because of something that's going on with your body.
And the hard water / soft water that we have on Guam in our showers. And
I have very few patients, like 2 or 3, that really cannot use the tap water and they have to use bottled water to wash.
Ouch.
Yeah.
All right, poor folks. Okay. Yeah. Question number 4 comes from the Capitals, and Vivian asks from Hagåtña, I use latex gloves, Dr. Lom, often at my work when dealing with patients, so maybe somebody in your profession. Is there an alternative to latex gloves?
There is, and it's called nitrile. Nitrile gloves are non-latex. They're usually a blue color or sometimes pink, and you can buy them at a medical supply shop, and they're around the same price, and they don't contain latex. They kind of feel the same, but they're called nitrile. The other kind of glove you could use is polyurethane. Those are the thin little gloves that they wear when they're making your Subway sandwich or whatever.
All right. I did not know that. That's interesting. Okay, we go back down to the south. John from Talafofo asks, how do I know if I have hand dermatitis or psoriasis?
Right, and that's another distinction that's really important, and we can tell the difference sometimes by doing a biopsy. Sometimes it's very difficult to tell, but with psoriasis, if people have big, thick red plaques on their palms and also on the soles of their feet. And also they'll have nail changes where there's pitting, thickening of the nail, raising up of the nail. These things will tip us off that maybe this isn't eczema. It has nothing to do with their environment. It's actually psoriasis. So that's when we check out with a biopsy.
All right, last question. This is the home stretch now. Kim from Tamuning says, I've been using various moisturizers, but it seems to be drying my hands out even more. Why? This
can be true. Maybe your moisturizers have a lot of fragrance in them. You know, nice smelling products sometimes aren't the best for you, or they may be too thin, like liquidy sort of lotions tend to be drying because they have alcohol in them also. So choose ones that are thicker and stickier and greasier. If you can't stand any of that, even try coconut oil or olive oil to moisturize your hands. Even that can help you.
All right, very cool. Well, doctor, thank you so much for your insight.
You're
once again.
welcome.
We certainly appreciate it.
My pleasure.
And remember, if you have any issues with hand dermatitis, you can visit Dr. Lom in person at Express Care. She's the nicest person in the world. Trust me, you will have a lovely time talking to her. She is on the second floor of the Agana Shopping Center, and she will be back again next week. At that time, we'll be talking about burns. If you've got a question, send an email to healthyliving@kuam.com or check us out on Facebook. You can always post a question on our wall. We would love to hear from you and pose a question to her. As for now, we're going to take a quick commercial break, but we'll be back after this.